Hi, this is Pete Keers for Cantissimo Senior Living. Cantissimo Senior Living was created to provide housing, education, community, and services to the senior living market. We understand the anxiety in choosing a senior lifestyle. We're trusted advisors providing free information resources in simple, straightforward language to help individuals discover vibrant, worry-free lifestyles. Check us out at CantisimoSeniorLiving.com. Cantissimo Senior Living, experience beyond measure. This video is the first in a series about preparing for Medicare. Most Americans reaching age 65 achieve a significant milestone, Medicare eligibility. Launched in 1965, Medicare is a national health insurance program created and administered by the U.S. government and funded primarily via payroll taxes. The program started with coverage for hospital stays known as Part A and coverage for other medical expenses like doctor fees, which is known as Part B. Together, these two parts are known as Original Medicare. Medicare operates as a fee-for-service system where a provider, hospital, or doctor gets paid for each service delivered. Over the years, Congress added additional Medicare components. Primary among these were Part C, which typically is known as Medicare Advantage. Under Medicare Advantage, private insurers provide Medicare benefits according to government regulations. And Part D, which covers prescription drug costs. Beyond knowing these basic facts, how can those under 65 prepare for Medicare? First of all, it's important to understand that Medicare is more or less mandatory if you're age 65 or older and want health insurance. Even if you have private health insurance, insurers require policyholders older than 65 to sign up for Medicare so those insurers don't have to cover 100% of health claims. However, knowing when and how to sign up for Medicare depends on answers to these 4 questions. Question 1. Are you age 65? If not, the only way to receive Medicare benefits before age 65 would be in some cases of disability or being afflicted with catastrophic diseases like ALS. Otherwise, reaching age 65 probably triggers the requirement to sign up for Medicare Parts A and B, depending on your answers to the next 3 questions. If you are 65 and still working, are you covered by an employer health insurance plan? If you are retired or working, but not covered by an employer plan, then you would be required to sign up for Parts A and B. If you're still working, go to question 3. Question 3. How many people work at the employer providing health insurance? Medicare has different rules depending on the size of the company offering healthcare insurance. For companies with fewer than 20 employees, signing up for Parts A and B is mandatory at age 65. This is because for these small plans, Medicare pays first and the company's insurance pays second. For employers with 20 or more employees, go to question 4. Does the employer's health insurance plan meet or exceed Medicare requirements? Medicare aims to deliver a certain level of health insurance coverage. If the health insurance provided by a 20-plus employee organization does not provide that benefit level, then you need to sign up for Parts A and B because Medicare will need to pay first. Conversely, if the health insurance plan meets the minimum requirements, then it is considered to provide creditable coverage. Creditable coverage is an important Medicare term. It is defined as an existing coverage that meets or exceeds Medicare's coverage. If a person has delayed enrolling for Medicare because they have private health coverage, then proof of such creditable coverage is required to avoid penalties when eventually signing up for Medicare. So, what's the sign-up process? Here's a surprise for many people. Did you know that when you sign up for Social Security benefits, you also are automatically enrolled at age 65 for Medicare Parts A and B? What about people who delay signing up for Social Security benefits until age 70? They need to pay attention because they are still required to sign up for at least Medicare Part A. Failure to pay to do so may incur cost penalties. Speaking of which, here's a rundown of possible penalties related to Parts A and B. Part A late enrollment penalty. This only affects the small number of people who don't qualify for zero premium Part A coverage in those cases. The Medicare Part A premium can increase by 10% for twice the number of years of not being signed up. For example, a person who delayed 1 year would pay higher premiums for 2 years. Late penalty for Part B. Unlike Part A, All Medicare enrollees pay a Part B monthly premium. If a person does not sign up for Part B when first eligible, the monthly premium may permanently increase 10% for each year the individual was not enrolled. For example, delaying Part B enrollment for 2 years could result in a permanent 20% premium increase. Overall, the best way to avoid Medicare late enrollment penalties is sign up on time or have creditable coverage. Some people may delay signing up for Medicare because they cannot afford premiums, deductibles, copays, or coinsurance. However, several alternatives are available to help pay these costs, like Medicaid, the Medicare Savings Program, and the Extra Help Program that helps pay Part D prescription drug expenses. To learn more about each of these programs, a Google search should point you to more information. As I noted before, most people enroll for Medicare automatically when they sign up for Social Security. Even for those who are not automatically enrolled, they still need to go through the Social Security Administration, or SSA, to enroll in Medicare. The reason is that SSA will affirm Medicare eligibility. Remember that Part A Medicare for prescription drugs is optional. I cover Part D in greater detail in another video in this series. 4 ways to sign up through SSA are online at www.ssa.gov/benefits/Medicare. Note that this requires a creation of a Social Security account. Next, you can call Social Security at 1-800-772-1213, or you can contact your local Social Security office. Original Medicare Part A and B has 3 enrollment windows. First is initial enrollment period. Applicants who enroll during the 7th-month period that begins 3 months before the month of them turning 65. Next is a special enrollment period. Some people do not sign up during the initial enrollment period because they or their family members are covered under a health insurance plan through an employer. In this case, there may be an opportunity to enroll in a special enrollment period. This 8-month period starts the month after employment ends or coverage ends, whichever comes first. Finally, there is the general enrollment period. If an applicant didn't sign up for Medicare during the initial enrollment period and is not eligible for a special enrollment period, sign-up can occur during the general enrollment period between January 1st through March 31st each year, with coverage starting on July 1st. However, delaying to the general enrollment period could trigger late enrollment penalties. Finally, for those who enroll in Original Medicare Parts A and B, there are costs for deductibles, copays, and coinsurance. In addition, there is no limit to out-of-pocket expenses. These gaps, which can be costly, so private insurance companies offer a Medicare supplement insurance policy, otherwise known as Medigap coverage. These plans have premiums above and beyond other Medicare premiums, but cover some of the gaps in Original Medicare coverage, including, in some cases, capping out-of-pocket expenses. However, Medigap is only available to supplement Original Medicare and cannot be used with Medicare Advantage plans. I hope this overview of Medicare has been helpful. Check out the rest of the videos in this series that explore the various parts of Medicare in more detail at www.cantissimoseniorliving.com/videos. This is Pete Keers for Cantissimo Senior Living. Talk to you next time.